Good afternoon. Thank you for tuning in today. We're going to talk about how patients use SecureML to connect with their healthcare community from home, with all the clinics they work with, different healthcare providers. We'll look at some examples how that happens, and we'll do a demonstration of the system. So my name is Jeff McKay. With me is Mark Hare. Mark, are you there?
Hi, good afternoon, everybody.
Awesome. Everything seems to be working great. So for the agenda today, we're going to look at real patient stories. So we collect patient stories regularly. We have a few hundred of them. Just patients describing how they use it with their clinic, how it changes the way they access healthcare, how it improves their access to healthcare, and in many cases, how it improves their overall health. As I said, we'll do a demonstration. After the demonstration, we're going to talk about MyHealth records, which is a service in Alberta that lets patients log in online to a secure portal where they can keep lots of different healthcare information, and Brightsquid SecureML is actually integrated in. So if you're a patient in Alberta, you don't have that set up, you can create your account, and we'll review how to do that towards the end. And then of course, the very exciting piece, we'll talk about the winner of the draw at the end and answer any questions. In that sense, if you do have any questions as we go through this, there's a question box in the GoToWebinar control panel which is in the right of your screen. You can just type in questions there and we'll get to them as we approach the end. So let's look at some patient use cases. This first one is I would say, a textbook use case. So what SecureML allows you to do as a patient or as a clinician or a clinic is to communicate in advance of appointments very easily. You don't have to worry about calling in, waiting on hold. You don't have to worry about your phone lines being clear. You don't have to worry about checking voicemail messages. You check messages when it's convenient, and everybody understands how email works. If I send a message, I don't expect a reply immediately. I do expect a reply, especially in a healthcare setting, but I know that this will come back to me. And it's hopefully clear to any users that SecureML is not an urgent means of accessing healthcare. And we have, in all of the almost 2.5 million messages that we've sent on our system, I have heard of 2 instances where it was improperly used in that case, and everything worked out okay. It was just kind of saying, "Ooh, you shouldn't have done that way" to a patient. So in this case, someone had an upcoming annual physical. They used SecureML to send some questions in advance. Based on the questions or concerns, the clinic sent over some requisitions. Hey, if you're feeling that way, let's get these tests done so we can talk about it. When the initial blood work came back, there were some concerns. The physician reviewed that, sent the concerns to the patient via SecureML. There's no need to set up a phone consult and waste time doing that, trying to align schedules. If all the information can be communicated in an email message or a typed message, all the better, because you don't have to worry about aligning schedules, someone not being able to answer the time they're supposed to, and then you have all that back and forth. And a lot of times, secure messaging can be done much more quickly. So from a clinician's point of view, the research shows it takes about 2.3 minutes to compose a message. When you think about a phone call, it can easily take 5-10 minutes, maybe, depending on what's being discussed. You end up talking about the weather, how are things at the clinic now with COVID, how are things with you with COVID, are you working from home, all that kind of stuff. You can get rid of that and make things much more efficient. So in the end of this interaction, sort of this back and forth and this planning for the appointment, by the time we got to the appointment, you can see at the bottom here, when I had my in-person appointment, we had test results and information in hand to discuss the plan of action moving forward. That makes the appointment much more efficient, and it also accelerates care. Imagine now, if everything had waited to the in-person appointment, and then at the appointment, here's my concerns. Okay, well, we're gonna have to look at that. Then you do the tests and everything after that. So you're delaying by weeks or months on something that might be more urgent to allow for that. So next, after hours contact, clinics are a business, and they operate typically during business hours. So lots of us as patients, that doesn't necessarily work. And we get lots of stories like this. Before SecureML, I had no way to reach out after hours. I can't leave a voicemail message. If it's like my clinic doesn't answer phones after 4 o'clock. And sometimes they shut down early. I've called at 3:30 and they say we're closed, even though I know they're not. So So this makes it way easier for patients to get in touch with clinics. If a question occurs to you at 9:30 at night, you don't want to write it down or forget about it or try to find time to get it to it in the morning or the afternoon the next day. You can draft a quick message and say, hey, here's a question I had about something. So, other people who work, we've got comments from people who work in frontline healthcare jobs. And or any other job, if you work in a cubicle, you don't want to call during the day. You don't want to call and talk to somebody because you don't want your end of the conversation to be overheard, or you just don't have time, or you just want to send a message during your break and then check for a reply on your next break. It makes things a lot easier. To share photos and videos. So obviously a secure mail account can carry attachments. We can do photos taken through a phone. And it can be sent directly from the phone. In that case, if you attach a photo and use your phone to take it, it's actually secure. So if your phone, if you're using an iPhone and you take a picture, it's typically uploaded to the iCloud, which wouldn't be secure and compliant with privacy regulations. But with secure mail, if you say I want to make an attachment, you can select take a photo. That photo is secure. It's not uploaded to the iCloud. So in this case, this person had a spot appear on their face. They took a picture, sent it to their doctor. The whole process of organizing, a review by a family physician, getting it to a dermatologist, and having that appointment booked happens through secure mail. So it's a really easy way to do that. We have places, instances of, neurologists with patients with tremors that they can't make happen an appointment. They say, I'll tell you what, next time it happens, take a video with your phone, send it to me through secure mail. Things like that just make access and care much more easy. And living in the reality of we're outside of the realm of bricks and mortars. We can't expect everything to happen inside a clinic office. Saving time at appointments is an easy one, right? You can do things like download requisition forms, confirm appointments, share information only, like we just talked about, so that I don't need to go into the office. On average, it takes a patient an hour and a half out of their day to complete a medical appointment. You compare that to the clinic. The clinic, it takes, maybe a half an hour by the time they're organizing everything. Nowadays, they have to clean the exam rooms in between appointments, that sort of thing. So there is a little bit of extra work involved, but it's not an hour and a half. So we're saving patients a lot more time by reducing the number of times we expect them to come into the clinic and the number of times that they have to. Other comments we get is things like, excuse me, I don't have to hire a babysitter for my kid to take the other kid into the appointment because I don't want to bring another kid into contact with something potentially, or I don't have to pay for gas to drive half an hour across the city, stuff like that. It makes it really easy for patients. Reduce travel, we just talked about that. Here's someone who lived 2 hours from their doctor, so I think this is actually a specialist situation. But when they don't have to travel, when they really have to travel, they can and they will. But for other little things, check-ins, how are you feeling? How's the medication working? Are you sleeping like we planned? Are you eating, sticking to the diet, the exercise regime? All that stuff can be done through a system like this where we don't have to align schedules, and it makes it a lot easier for people. And we get a lot of comments like, it's been a life changer. Thank God for secure mail, a lot of stuff like this. I look forward to using this with more providers. A lot of comments like that. This one is near and dear to my heart because I have 3 now 7-year-olds and they can be quite loud. So if you're home with kids or like I said, in a work situation where talking on the phone is difficult, it's really easy just to have a text conversation back and forth in a thread that's referenceable. That as a patient, I can pull out my phone if I can't remember exactly what was said by my provider. Oh yeah, I just pull up, oh, that's what she said, right, I'm supposed to be doing that. Or here's my medications, that sort of thing. And again, comments like, I absolutely love the service. It brings a lot of convenience to healthcare for patients as well as providers. We get a lot of comments from people that say, I know this helps me and it helps my clinic do things a lot better. So that kind of it brings us to the end of our discussion around different use cases. Again, if you have any questions about it, certainly put them in there. There's loads of examples of these kinds of things. As Mark's taking over here, the other thing that happens with secure mail is email is actually a smaller amount, an easier amount of data to transmit over the network. So phone calls are actually hard to connect. So with reduced service in areas of reduced mobile service, sometimes it's easier for patients to send a message than it is for them to call a clinic. And there's a great example that came in from a patient who was camping out in the wilds and needed allergy medication and couldn't get the cell phone reception to make a call to the clinic, but was able to actually get enough service to send a message to them through secure mail, and then got the prescription renewed and was able to pick that up, a pharmacy nearby or something, so they could get the, you don't want to be stuck out in the wilderness without your allergy medication if something's going to go wrong. So lots of different use cases that we don't always think about how secure mail actually fits better into your life. And we do use email and text a lot in our lives without really thinking about the convenience that they bring, because we're so used to that now. And introducing that in healthcare, sometimes it helps to look at the examples of how it actually works for people. So with that, Mark, I'll let you take over and go through some of the ways that these events happen.
Yeah, thanks a lot, Jeff. You showed a couple of examples there, but like you also mentioned, we've seen somewhere between 2.5 and 3 million patient messages go through our system in the last 10 years or so. And there's literally thousands of different examples as to how secure mail can be used by our doctors and by our patients and every other medical professional that's logged into our system. So we could talk for hours about this, but of course, no one will listen to me do that. So we'll try to keep it short. So I started sharing my screen while you were just wrapping up there, Jeff. So right now, everyone should be able to see what's on my screen, which hopefully looks familiar to all of you. This is the login page to your Brightsquid Secure Mail account. Now, on the login page, most of us probably fly right past it without giving it too much thought. We ask you for your email address and your password, but a couple of important things are on here, and I'll just show you a couple of tips and tricks about secure mail as I go through today's conversation. First of all, we are here to help you in any way that we can. You can reach out to our customer service and support team in one of three ways. There's our chat icon down here in the bottom left-hand side. You can always chat with us and ask for assistance. Now, be advised that our support agents can't answer any medical questions, but in terms of how to use secure mail, how to compose a message, we're here to help with that in any way that we can. You can also connect with us through phone or traditional email, or even through secure mail if you like, and you can reach us here through our contact us for help link at the bottom of the page. Now, having said all that, I can tell you with some amount of certainty that about 95% of our questions are, how do I reset my password? Well, the answer is right here. There's a forgot password link on the login page. And anytime that you go to the login page and you may have forgotten your password or typed it incorrectly, you can click that button and we'll send you an email that will allow you to make up a new password for your account. But failing that, don't hesitate to reach out to us and we're happy to help. So I'm going to log in now as a patient named Adam, and I want to show you something. When I type in Adam's email address, you'll notice that as I start typing, I type in my email address, I should say, because I'm Adam in this scenario, my browser automatically recommends or suggests my login information because I've used my computer for years, and it kind of knows what I want to log in as. But it's important to note that sometimes these suggestions get mixed up. And sometimes they may be off base, especially if I share the computer with my wife or my son. The wrong information may be selected. So just be aware when you're logging in that you're typing in your full complete email address and your password as you created it. Sometimes the suggestions can be wrong, is really what I'm getting at. So I've entered Adam's information, or my information if I should, and I'll click on login. Now, when I log into my Brightsquid account, the first thing we're going to see, of course, is my my inbox. Oops, I must have done something wrong. Look at that. After all my vaunted conversation about typing the right information, I put in the wrong username and password. Let me try that again. Well, it appears something with my demonstration environment has gone off the rails on me here. So I'm going to quickly switch over to another server. I apologize for the delay. And I'm going to log in into a different system. So again, I apologize for the mix-up. You know what, Jeff? It looks like my internet connection is failing on me here. I'm going to have to ask you to jump in and bail me out because I am running into a problem with my computer.
Oh, geez. Okay.
I'm going to stop sharing here for a second. Give me a moment here. I'll see if I can bring this back online. Just give me one moment.
I'll just continue with the presentation. So let me we'll get into, we'll adapt here. we'll go into the MyHealth records discussion. So we talked about MyHealth records. So back in April of 2020, when it was difficult for people to go into the clinics, we were trying to get people to stay home. The government of Alberta wanted to give patients and clinics a way to connect remotely. And the government of Alberta MyHealth records system was launched, I believe, in 2018 as a way for people to access certain information online. We'll go over what that is, but they integrated SecureMail into this service. So the government of Alberta MyHealth records system is an online tool that lets Albertans 14 years or older access some of their health information from Alberta Netcare. So that's the system that collects and stores all of your health information around immunizations, test results, any diagnostic imaging, that kind of stuff that clinics can use to access your information. Now, not all of your patient record is stored there, so you wouldn't see notes from appointments, that kind of thing. But let's look at what you can do. So you can keep track of your health in one place online, and you can get stored and managed. So you can now, with SecureMail, you can collect information from different providers that you work with. This is a big, long list. The most important thing right now is you can access COVID-19 test results, typically before they're ready. And you can also access the test results of your children. So MyHealth records is only available to people who are 14 years of age or older. So you have elementary age school kids, and they're home because they've sneezed in class or coughed or something. Now you can go in and access the results sometimes up to a day or 2 days before you would get the results otherwise, because as soon as the results are done, almost, they're posted. So you just need to go in, you can log into your account and access your child's information with their healthcare number. So you can see medicines that have been prescribed or you picked up from pharmacies, most of your immunizations, common lab test results. You can actually use it to keep journals. So, food journals, sleep journals, fitness goals, track your mood, that kind of stuff. You can upload information from your Fitbit or any other similar device. And then you'll be able to share that with your providers. You can download reports. So you can look at, if you're tracking your blood pressure or some test results that you get regularly and you want to keep track personally of how you're doing, you can do that there. And then because it's connected to SecureMail, I'll show you how it is connected. You can send that information to any of the providers that you work with who are on the system. To create an account, if you haven't yet, you have to first create a My Alberta Digital ID, which uses your driver's license and the information on there to enter that, and then you set up the account, and so then you create your MyHealth records account. It used to take up to a month. You have to be mailed a code, and now they've waived that. So you actually have 30 days to use the system before you have to enter the code. When I did it, it took about 2 days for the mail to show up anyway, so it's pretty quick. So that's MyHealth records. You can log in and show it. It's connected. Oops, here we go. You just go to the messaging tab, and then you can actually connect your SecureMail account directly from there. We'll use your information in MyHealth records to verify your ID and pass that through to create your login information. If you already have a SecureMail account, we actually recognize your email address in your MHR account, MyHealth records, and connect it to an existing one in Brightsquid SecureMail. And then there's a bit of consent that you have to go through, but it's pretty quick. Say, yeah, I'm fine with my information being shared here. So I see that Mark is back and ready to go. Mark, do you want to just take over and we'll finish up the demo, and then we can come back and do the winner of the draw at the end.
Awesome. Thanks for sticking with me, everybody. I'm not sure what happened to my computer today. In all my years of doing webinars, I've never had one fail quite that badly. But at any rate, I've restored sharing my screen. And as I mentioned, I wanted to show a couple of tips and tricks about using SecureMail to communicate with all of your medical providers. One of the common questions we get from patients that have just been invited to Brightsquid SecureMail, because in most cases, I mean, Jeff talked about the MHR system and how you can register for an account there if you don't already have one. Most of our patients wind up using SecureMail because they're invited by one of their medical providers. But it's really important to note that you can use secure mail with all your medical providers, within reason, of course. When I say all, those that have Brightsquid accounts. So for example, I'm logged in right now as Adam. And as you can see in Adam's inbox, he has messages from the Fauchard Clinic. So presumably that's his dental practice. And here's a message that he received earlier where they're asking some questions about his migraine headaches or other concerns. And this was one of the common use cases that Jeff was talking about, where prior to my actual appointment with my doctor, the doctor's office might opt to send me a list of questions that they would like some answers to before I come into their clinic. So here's a really good example where I can just reply to this message. It'll go back to my doctor's office and I can type my answers here right underneath each of the questions. So yes, my headache is throbbing, they last about 2 hours, et cetera, and so on. And then when I'm satisfied with all my answers, I click send. Now that will be delivered back to my clinic's office managers, and the office managers can put that information in front of the doctor so that by the time I sit down with the doctor on Friday afternoon, he or she will already know some of the information that they're going to be diagnosing for me that day. But what I wanted to point out is that, as I mentioned, if I go to my directory, we'll see here that I have sort of communication access to the doctor that invited me in the first place. And that's the Fauchard Clinic. And the person I speak to most often in the Fauchard Clinic is Ms. Clara Barton here. But as I was saying, I'm not limited to only talking to that clinic. I might also want to talk to my specialist. Maybe I have back problems and I have some conversations going on with my spinal clinic. Well, let's have a look. Let's find out if my spinal doctor is in here. Oh, look there. Right down here is the spinal network. So this is my doctor that I go to for my back problems. So as it happens, they also have a Brightsquid Secure Mail account. And so I am more than welcome, more than happy, I suppose, to compose messages to this practice as well. So when I'm composing messages, I can address a message to any of the providers that are listed in the Brightsquid directory. And you will find literally tens of thousands of them. On that directory page that I just left a moment ago, you can search for your clinic, either by the name of the clinic or the name of your doctor. You can filter the results by your jurisdiction. So by default, it'll search for whatever province or state you might find yourself in. So Alberta, Saskatchewan, Ontario, California, Utah, wherever you happen to live, it'll automatically filter and find results for you that are close to home. And then you can just select the practice you want to send the message to, as I've done here, and then I can just compose my message and send whatever I need to this doctor's office. So I'm just going to write the subject line of test. Here is the photo, oops, pardon my typo, of my skin condition. Now, this probably isn't something I would send to a spinal surgeon, but just as matter of for demonstration purposes, I can send a photo of something or someone. So I'll click on the browse button here and I can select from my computer any file that I may want to share with my doctor's office. Here we go. Here's me, someone smiling. And then once that file gets uploaded, I would click the send button down here, and this will be sent off to my doctor's office. Now, I'm doing this on my desktop computer, which is a Windows 10 computer, but of course you can use just about any internet device that you might be comfortable with. So that includes Windows computers, Mac computers, iPhones, iPads, Android devices. And the really cool thing about using a mobile device, like an Android or an iPhone or an iPad, is when you click the browse button on one of those devices, the service allows you to use the camera on that device to take a picture of something. Now, it might be a picture of something on your skin, like a wound or a skin lesion or a rash, or it might be a picture of a document that your doctor asked you to share with them. It could be a survey or a questionnaire you filled in. It could be a photo of your insurance card or your personal health information that they might need for their records. But because of the versatility of your mobile devices, you can take a photo of just about anything and then securely share that information with your doctor's office. So getting back to what Jeff was saying earlier on, and I guess what I was saying as well, there's literally thousands of different ways that you can use secure mail to communicate remotely with your doctor, saving yourself trips across town, exposure to various pathogens that will remain nameless in this conversation, and also just saving yourself the trouble of going outside and traveling when the weather is bad and there's snow on the ground and all kinds of different reasons that it's just more convenient and more economical in many cases to communicate from home. Not to mention the synchronization issues that phone calls always seem to present. This way I can send a message to my doctor any time of day and they'll respond to me in their business hours. Anyhow, I had to cut my demonstration a little bit short today because of my technical issues, but I'm going to throw back over to Jeff and we're going to wrap up here really quickly. And hopefully if we have some time, we can answer a couple of questions before we reach the top of the hour. Are you there, Jeff? Jeff, I think you're on mute, buddy.
I was. Yeah, no, that was the one thing I forgot. I got my screen up. I just wanted to talk quickly about this, people write in about MyHealth records too. Being able to access my test results means not going back to the doctor and tell me what I can read at home. It's an important use case for a lot of people. Travel can be a burden, and especially these days, especially with public transit, all that kind of stuff we want to keep people away from. The amount of time we can reduce people from going into clinic when unnecessary, the better. And so with that, that brings us to our end here. And for the gift card, our winner of $25, because we understand that it's time out of your day. We want to thank you for taking the time to join us and learning about Secure Mail. Today's prize goes to Lois. So Lois, congratulations. We'll be contacting you with the prize. So questions quickly. We do have a couple. So let's see what we can get to. And from a patient perspective, you can learn more information about Secure Mail on our website, the URL there. So questions, Mark, for patients to use the system, is there any cost ever to connect with providers? That's kind of question number one.
No, absolutely not. Yeah, the Secure Mail is free for our patients, so you can always send messages to your doctor's office. You can always receive messages from your doctor's office, and it's actually, it's always free for patients. So that's that.
Yeah, okay, great. And the other question, and maybe I can chime in if maybe you have answers too. We talk about taking patients out of the clinic. We operate mostly in a fee-for-service environment, and in Alberta specifically, there's lots of discussion around physician compensation. Clinicians being able to make a go of it and have a viable business, and so by taking patients out of the clinic, is there ways that physicians get compensated for Secure Mail? And the answer is in Alberta, yes. Yeah.
Sorry. Yeah, go ahead, Jeff. Why don't you answer your own question?
Well, it's not my question. So,
I know.
So it actually is. So yeah, the government has implemented. They're called fee codes, and so physicians can be compensated for using services like Secure Mail for secure communication, to provide advice, and also to do consultations with other clinics. So, like in the example that we looked at, a person with a spot on their skin, consulting with a dermatologist, physicians can be compensated for that, and the dermatologist can actually be compensated for responding. So we're moving in the direction of actually enabling virtual care like this, remote access, so that we don't, force clinics into a position where they can't operate if patients don't come in, because there's obviously an astute recognition that there's lots of room for remote care. It certainly isn't going to and shouldn't replace all of the care or even most of the care. A lot of that still needs to be done in person, but there's absolutely ways for physicians to operate in this way that can support both their business and good patient care. Now that brings us to the end of our time today. So I want to say thank you very much for tuning in, Mark. Thanks for your time today, the demo, and thanks for rolling with the little internet issues that we had. And we'll be sending out the recording and making that available to everybody. So please stay tuned for that. And any other questions, like Mark said, please always contact our support team. We're here to help. Thanks so much.